there, welcome back. It's Dr. Michelle, and today we're going to talk about something that we all are going to go through as women. Every single one of us will go through menopause, and most of us will experience symptoms. But there's a big problem. Most doctors are not going to offer a hormone replacement therapy. So we're going to talk about that today and why it's an issue. Hi, I'm Dr. Michelle Sands, naturopathic physician and female hormone expert, and on this channel, I help women understand and fix their hormones. So today we're talking about the sad fact that so many women are not even offered the #1 solution for their perimenopause and menopause symptoms. So why the heck are so many doctors ignoring the most effective treatment for menopause and perimenopause? I'm talking about hormone replacement therapy. What's the deal? Why are they not giving it to us? So something really needs to change because it's not fair for such a small number of menopausal women to receive medical attention that they deserve while the rest of us have to suffer. So I'm not saying that every woman has to take hormones, but what I am saying is that every woman should at least get the option to make that decision for themselves. It should not be made by their doctor. And it's actually a big problem. And there was a study done recently by Yale University, and they looked at the insurance claims from over 500,000 women. And all of these women were in various stages of menopause. And what this study shows is that 60% of these women had significant menopause symptoms that were interfering with their quality of life. And that led these women to go seek medical assistance. But 75% of these women who went to their doctors with all the signs and symptoms of menopause received no treatment at all. This is unacceptable, especially since we now know that women who use bioidentical hormone replacement therapy in the right dose and delivery method, they actually live longer and healthier than those who don't. So they have less chance of dying than women who do not take any therapy at all. So if you've had problems getting help from your doctor dealing with your menopause symptoms, or if you've even had just a hard time getting your doctor to listen, you are not alone, and that's what drove me to make this video. So the problem is, despite all the discomfort that women experience throughout menopause, and despite the availability of safe and effective therapeutic options that truly improve quality of life and prevent a number of chronic illnesses, only a very small fraction of women are actually treated properly and given the opportunity to replace their hormones. So why is this happening? Well, unfortunately, menopause education is not taught in most medical schools or in residency programs. And according to a recent AARP article, a recent survey showed that only 20% of OBGYN residency programs give any menopause training. So this means the vast majority of doctors, OBGYNs, endocrinologists, and general practitioners are not equipped to help you through the menopause transition. They have no training in this area. And to top it off, the North American Menopause Society actually provides guidelines to doctors for menopause treatment. Unfortunately, these guidelines seem to favor the use of antidepressants and pain medications as a first-line treatment of menopause symptoms, even when the problem is clearly a hormone deficiency, not an antidepressant deficiency. So it's not entirely your doctor's fault. It's simply that he or she doesn't have the training and the guidance is not proper to actually help you. And apart from all of that, the fact that many practitioners are unprepared to deal with menopause symptoms, there's also a huge misunderstanding about hormone replacement therapy as a whole. There's many misconceptions, and the concerns around hormone replacement therapy can actually be traced back to a study back in 2002 called the Women's Health Initiative. Now, you may have heard of the Women's Health Initiative. It was a multi-state study, and the aim of the study was really to look into ways to keep postmenopausal women from acquiring heart disease, breast and colorectal cancers, and osteoporosis, which that idea is actually a great thing. The problem is the way the study was done. So the study basically gave birth to widely believed but truly false idea that all hormone replacement therapy raises your risk of cancer, heart disease, and stroke. Now, the problem is it's really important to know how the study was run. The study exclusively used synthetic oral equine estrogen or horse estrogen called Premarin, and synthetic oral progestin, not progesterone, called Provera. So Premarin and Provera were used. And they had two different arms of the research. And what happened was there was one part of the study where the women were given both equine estrogen, so horse estrogen Premarin, and synthetic progestin Provera. And then the other group was only given the equine estrogen, the Premarin. So surprisingly, the women who only got the horse estrogen, those women didn't actually have any significant increase in breast cancer, despite the fact that they were using a stronger, significantly more estrogenic estrogen that's not even meant for humans, but their breast cancer incidence actually remained the same. In contrast, the other group that took the equine estrogen and the Provera, the progestin, they actually did report a modest increase in breast cancer risk over time. Unfortunately, all the media coverage and the news and the medical community jumped to conclusions and misinterpreted the study, and that led to all types of anxiety and suspicion around all forms of hormone replacement, and that actually has persisted to this day. There's this irrational fear that hormones and somehow are bad for you, and that has led the way for women to just continue to suffer. Subsequent studies, as recent as this year, have supported the use of hormone replacement therapy in the proper dose, in the proper delivery, and they have shown that these can prevent heart disease, osteoporosis, dementia, and reduce the risk of all-cause mortality, while also at the same time helping women have relief from those menopause symptoms and have a better quality of life. So these newer studies really stress the importance of using the appropriate type of hormones, the appropriate dose of hormones, and the right delivery method to increase the benefits and reduce the risk. So what can you do? Well, the fact that you're here and you're educating yourself about menopause and health by watching this video is a really good first step. This is really what you need to do to empower yourself, to educate yourself, because the more you know about your health and your hormones, the less likely you are to be one of those women who spend a third of their lives coping with menopause symptoms and dealing with the aftermath. And so the better understanding you have of what to expect, how to respond, and how to advocate for yourself, the better your outcome is going to be. Effective treatment will not only alleviate your symptoms like your hot flashes, mood swings, insomnia, belly fat, but it also really plays an important critical role in preventing chronic diseases like heart disease, osteoporosis, dementia, and all the things that plague aging women. So I strongly encourage you to continue learning, asking questions, and advocating for the best possible quality of life for yourself. So be sure to check out this video where I did a live Q&A answering all types of questions about menopause, perimenopause, and hormone replacement, and subscribe to this channel so that you can get notified when I post a new video. You can also check out my free masterclass, What Every Woman Needs to Know About Hormone Restoration, where I go deep dive into really more details about what we talked about today. So the link is right under this video in the description box. That's all for now. Thanks so much for watching, and remember, the more you know, the more you glow. Take care.